surprising to know how many people are living with this condition. 1 in 100 people in the UK has epilepsy. Over 600,000 people are living with epilepsy in the UK. For 1/3 of people with epilepsy, their seizures do not respond to current treatments. 79 people are diagnosed with epilepsy every day.
My name is Ryan-Elliott and I'm 33. I received epilepsy almost 10 years ago when I was over in Las Vegas. I do not remember anything. I fell down 51 steps and cracked a large section of my skull and had to have a cranioplasty, which has caused my epilepsy and aphasia. So aphasia is a speech and language disability. It causes me issues with speech, reading and writing. And within the Las Vegas hospital, I was within there for about 4 weeks. So I was privately flown home to London. I was taken to one in Tooting, St George's, and I spent, I believe, about 4 months in there. And that was when my first seizure happened. I was with my sister and her boyfriend. We went out for dinner and I suddenly realised it was a simple focal seizure. Before the injury, I was in sales, and obviously having epilepsy and aphasia, that is to do with speech, reading and writing, and especially obviously with the aphasia, that's exactly what you need. So I can't really be doing that, and at work it's caused problems. People just don't really understand disabilities and just hide people away who have disabilities. I'm now a videographer. I've spent the last 5 years studying video photography and out and about every day taking videos, and then home editing. My epilepsy is going, I don't know if that makes sense, going quite well, because when I have a seizure, my doctor often updates the medication that I'm having, and at the moment, touch wood, it's going quite well. So I think I haven't had a seizure in about 370 days.
Today, Tom has come to the Epilepsy Society, a world-leading centre for research, advocacy and care, to find out from the experts exactly what epilepsy is and how it is diagnosed and treated. To help us understand more about epilepsy, we're going to hear from epilepsy specialist nurse Michael Sabajon.
Would you mind explaining exactly what epilepsy is?
Epilepsy is actually a group of conditions with one thing in common: a tendency to have seizures that start in the brain. There are many different causes for epilepsy. This could be caused by a structural change in your brain, such as a tumor or as a result of a stroke, or an infection, such as meningitis. Or it could be genetic. This may have been passed on by one or both of your parents, or it could be a genetic change that has not been inherited. Anyone can have seizures at any time of their life. It does not matter what age, gender, or race you are. We all have millions of neurons or nerve cells charging around in our brains, passing messages to each other via electrical signals. It is what makes us function. But if the electrical signals become disrupted, or there is an unusual burst of electricity, this is when a seizure might happen. And it will depend where in the brain the seizure starts as to how the seizure affects the person. There are many different seizure types. A person may appear to zone out and become unresponsive, or they may start making chewing movements and fiddling with their clothes, or they may start wandering around without really knowing where they are. Some people only have seizures in their sleep, and it is important to remember that, although in general, people recover from seizures quite quickly, in very rare cases, seizures can be fatal. In the UK, 1,200 people die from their epilepsy every year. But perhaps the seizure type that most people are familiar with is the one where a person falls shaking to the ground.
So how would you help someone who is having a seizure?
Stay calm, cushion their head, call for an ambulance. Calm, cushion, call. The emergency call handler will be able to assess the situation and decide whether the person needs an ambulance.
Getting a diagnosis of epilepsy can involve many tests. Tom is visiting the EEG clinic where Fiona Farrell will be preparing Nikhil for a test.
Hi Fiona, would you mind explaining a little bit more about the tests that you'll be doing today?
Not at all. Come on in. Come and have a seat, Tom. Nikhil, have you had an EEG done before at all?
I've never had one before.
It's your first time.
Yes.
So what we're doing is recording your brainwave activity by sticking some small electrodes onto your head, only on the surface of your head. We use some paste to hold them in place, and that's all water soluble.
Nice.
Okay. Once they're all in place, we'll start recording your brainwave activity. We'll also actually record a video of you. Just should anything happen whilst you're in the room, we've got a recording of it which will help the doctors diagnose any issues that are going on.
Cool.
Yeah. Okay. So at the moment we've got one electrode on Nikhil. We actually normally have about 25 to 30 electrodes, depending on the patient, depending on what we need to do. So Tom, when we're doing an EEG, what we're looking at is the electrical activity in the brain. So it's not like a scan where they're looking at the structural changes. We're looking at how the brain is working. So when we're looking at an EEG, we're looking to see the rhythms that we expect to see present in the brainwave activity and any irregularities or asymmetries. That's a really important thing. Is something different happening on the right side than is happening on the left side? And that all helps with the consultants tying down the area of the brain or the side of the brain that's involved in their epilepsy. We also routinely do photic stimulation, where we flash lights at a varying frequency, so from 1 hertz, so 1 flash per second, through to 50 flashes per second. There are a very tiny number of patients who have photosensitive epilepsy, about 3%. But this just allows us to pick up on that. We never intend to trigger a seizure, so we were always looking at the EEG, and we could turn it off the minute we see any abnormal epileptiform activity.
The Epilepsy Society also carry out MRI scans, which give huge amounts of information to help towards the diagnosis and potential surgery.
So what we're doing today on Nikhil is we're trying to look at the exquisite anatomy of his brain, and MRI is a brilliant tool with which to do that. What we're doing with functional MRI is we're looking to see which side of the brain the patient uses for language. So most people are right-handed, and this will be the left side of their brain. Left-handed people, 60% of them, it's still the left side of their brain. But if you're one of the 40% that uses the right hand of your brain, what we're doing is trying to work out surgical outcomes and be able to give people a choice whether they want to go ahead with surgery or not, and how it will affect their language, their memory, and other factors are also taken into consideration. We've come up with these beautiful pictures that are cutting through the brain at 1 millimetre slices, trying to look for a structural cause for his epilepsy. And if we find somewhere where there's a problem, and if that's causing the epilepsy, then the surgeon can remove it. And hopefully that will lead to seizure freedom.
Living with epilepsy doesn't just affect the person. It can also affect families, friends, colleagues and communities. Karen's son has epilepsy and is currently away at university.
My son was 18 when he started having tonic-clonic seizures, which came as a real shock because he'd had childhood epilepsy, which we thought had passed, so it came sort of out of the blue. So it's really affected everything. It's affected the whole family. It's put a lot of stress on everybody. People tend to see that epilepsy is just sort of the actual seizures, and they just see it at that moment in time, but actually there's so much more going on in the background. It's not just the seizures. So yeah, he's suffered terribly with depression, anxiety, as well as all sort of logistics as well with him being away at university. It's put a lot of pressure on everybody. So Ben has been at university now since he was 19. Unfortunately, he's had to sort of leave and come back on medical grounds. But while he's away, it's very worrying because obviously he wants to be a normal university student, go out with his friends. He doesn't want to feel as if he's checking in with me. But obviously on the other end of it, I'm always, are you okay? If I haven't heard from him for a day, I'm busy phoning him. So SUDEP is something that does worry me as a parent. It was made very clear to me by my son's neurologist at one of our first meetings, because he thinks it's important that everyone is aware of it. So that's sudden unexplained death in epilepsy, which can happen immediately after a seizure, which I don't think a lot of people are aware of. So yeah, it's a main concern of mine. I must admit that I have, if I haven't heard from my son for a while, or he's not answered his phone, or I can see he's not been online, that kind of thing, I do start panicking, because there's always that going on in the back of your mind. Every time he has a seizure, your heart just stops. It's almost like a panic. You know what you have to do, but there is that sort of panic inside that, this could be the one, or it's not going to stop. So yeah, there is a real fear of that.
At the Epilepsy Society, not only do they treat people with epilepsy, but they also carry out pioneering research to improve the diagnosis and treatment of epilepsy. Tom is meeting with Dr. Lisa Clayton, who is one of the researchers in the genomics team at the Epilepsy Society.
You've probably already been hearing about how epilepsy is really a relatively common neurological condition and affects about 1 in 100 people in the UK. But of course, for each person with epilepsy, their epilepsy is really unique and individual to them. And it can be unique in a whole number of ways. So unique in the way that it causes their seizures, or the types of seizures that they have. And we're starting to understand more and more that some of those differences might lie in our DNA, in our genes. So our research is focused on trying to understand as much as we can about somebody's genetic background, so we can understand about their particular epilepsy, and therefore, of course, improve treatments and care for them. So humans are made up of billions of different types of cells, and in the heart of most of those cells we have our DNA. And our DNA is kind of like an instruction manual or a recipe book, and it tells our bodies how to grow and function and work and behave normally. And in humans, our DNA is made up of 3 billion letters. Some of those letters are grouped together to form genes. And genes give precise instructions for making proteins. Now, if you look at all of our DNA, all of us have differences in our DNA. It's what makes us unique. It makes us who we are and gives us our characteristics. But sometimes a difference in our DNA, so a change in some of those letters or one of those letters, might affect a really important gene. And it might mean that that gene no longer makes the protein that it's meant to, or it makes a protein and that protein doesn't work in the way it's meant to. And sometimes that can lead to disease, and sometimes that can cause epilepsy or lead to epilepsy. So for some people with epilepsy, we know that their epilepsy is caused by differences in their DNA, differences in their genes. Now, the first epilepsy gene was discovered in 1995. But today, we now know of more than 800 genes that, when they have changes in them, might cause epilepsy. And because of that, we are able to diagnose more and more people with particular types of genetic epilepsies, or we're able to find in more and more people a genetic cause for their epilepsy. And so overall, our kind of vision for our research and our epilepsy care here is this uniquely person-centered approach, where we find as much as we can about their genetic background. We mix that with our understanding of their brain imaging from their MRI scans and other imaging. We think about their EEG and use information from their EEG, and we put it all together to do as best we can to provide the best treatments for our patients, our people with epilepsy.
Lastly, we're going to hear from Claire Pelham, the Chief Executive of the Epilepsy Society, to find out how you can get involved and help make a difference to the lives of people with epilepsy.
I have days when I come back to my office from the research centre when I see firsthand how important the work that our scientists are doing. And I sometimes pause and think, oh my goodness, the hopes and dreams of so many people are resting on that research. And every day, by some miracle, when I look at my emails, when I open my post, there are wonderful fundraisers stepping up to the plate. And I really, really hope that we can rely on you to join their ranks, because we need every penny to fund an MRI, every penny to fund a genomic sequence, every penny to bring control over seizures to somebody who so desperately wants to hold their child as they walk down the street. Thank you for your help.
We all want people with epilepsy to live and work with the knowledge that their condition is understood.
So I think it's important because the Epilepsy Society is really spreading the awareness of this hidden disability that not many people know about.
I think the biggest thing, the way in which they helped me, is they helped me understand what epilepsy was.
That is not just from a medical perspective, it's very much supporting everybody in their lives on a day-to-day basis.
Hopefully, this has given you an insight into what epilepsy is, how it is treated, and the impact that it has on people's lives. You can help support and find out more about the incredible work that the Epilepsy Society carries out by visiting epilepsysociety.org.uk.